My name is Charl Els and I'm a clinical professor in the Department of Psychiatry, and I'm appointed as a physician educator in the Division of Preventive Medicine, Department of Medicine at the University of Alberta. This session focuses on the occupational impact of cannabis consumption, with particular focus on safety-sensitive workplaces. Thank you to the Workers' Compensation Board of Alberta for making available funding for this project. There are no conflicts of interest to declare. The opinions expressed in this presentation reflect those of the speaker and are not necessarily those of any collaborator or funding agency. This session provides a brief overview with a single focus on the question of whether cannabis use is compatible with working in a safety-sensitive setting. Cannabis, marijuana, has been around for millennia, and in Canada, after almost a century of prohibition, it's about to be legalized for recreational purposes. Since the year 2000, following the case of R versus Parker, it has been available for medical purposes. And this is the case despite the relative limited availability, that is low and moderate quality evidence supporting the effectiveness of cannabinoids for medical use, as well as in the presence of a significantly increased risk of adverse events. Nevertheless, in the 2015 throne speech, the announcement was made for the 2018 legalization of cannabis. The government plans to legalize, tax, and regulate cannabis. Bill C-45, the Cannabis Act, will allow for recreational use from the middle of October 2018. The cannabis sativa plant delivers over 400 different chemicals, of which more than 100 are cannabinoids. The best studied of which would be tetrahydrocannabinol, or THC, and there's a whole range of others: cannabidiol, cannabinol, cannabigerol, cannabichromeme, cannabivarin, and cannabicyclol. THC content in cannabis products has increased since the 1970s, when it ranged from some 2 to 8%, to strains today yielding a potency of around 30% or higher. There's a growing trend of achieving ultra-high THC potency products by using methods such as butane extraction, yielding a product called butane hash oil, or shatter, with THC concentrations reaching some 90%. The occupational challenges that emerge. There currently exists no reliable method of controlling dose, and there's no legislative standard for the measurement of cannabis-related impairment. A lot of misconceptions exist. For example, that any use constitutes impairment, that if a drug is authorized or prescribed, it is safe and not occupationally impairing, that drug or alcohol use is the most common cause of occupational accidents and injury and death, that urine drug testing is the solution to the issue, and the list goes on. A number of misconceptions out there. According to Stats Canada, cannabis remains the most commonly used illicit substance and the single most commonly encountered substance in workplace drug testing. Considering workability, capacity, risk, and tolerance, what are the cognitive and performance demands associated with safety-sensitive work, and what are the effects of cannabis on occupational performance? Cannabis consumption has been demonstrated to have an adverse impact on a range of cognitive functions, as well as an association with performance deficits. In occasional and regular users, this may result in broad impairment of cognition, including decision-making as well as cognitive flexibility, and this may plausibly and foreseeably translate into an increased risk of human error. It's been established that the cognitive skills required for safety-sensitive work tasks overlap to a significant degree to those required for safely operating a vehicle. The required cognitive skills and capacities to operate a vehicle include unimpaired alertness, attention, concentration, coordination, reaction time, memory, ability to multitask, perceptual abilities, thought processing, judgment, and insight. And driving can be viewed as an ideal proxy for determination of levels of impairment for other safety-sensitive tasks and duties. An extrapolation from crash risk data has been widely used to perform risk assessments in other settings, and it was the use of such extrapolation methods that resulted in the American College of Occupational and Environmental Medicine's guideline suggesting that the use of opioids is incompatible or not recommended for people working in safety-sensitive settings. Now, there's sufficient evidence to support the notion that cannabis, like alcohol, like opioids, can impair the skills required for safe driving, and that it's associated with increased motor vehicle crash risk. To add to this, there's no epidemiological evidence available to suggest that the cognitive impairments associated with cannabis are not a problem in safety-sensitive positions. And certainly no licensed producer of cannabinoids or any maker of pharmaceutical-grade cannabinoids has ever declared it occupationally safe in positions that are indeed safety-sensitive. Given that single or recurrent cannabis exposure or use can result in both cognitive as well as performance deficits, as well as the evidence that it is associated with increased motor vehicle crash risk, the extrapolation of risk to safety-sensitive occupational settings appear reasonable and suggests that it's not recommended in those settings. What is the duration of impairment, and for how long can a person remain impaired after single or chronic consumption of cannabis? The answer is by no means straightforward, given the fact that this compound is highly fat-soluble, and it may depend on a variety of factors. The College of Family Physicians of Canada applied the 4-6-8 rule, suggesting that patients taking medical marijuana in the form of dried cannabis should be advised not to drive for at least 4 hours after inhalation, 6 hours after oral ingestion, or 8 hours after inhalation or oral ingestion if the individual experiences euphoria. Yet, Health Canada suggests that the ability to drive or perform activities requiring alertness may be impaired for up to 24 hours following single consumption. To compound the issue, other evidence suggests that some cognitive impairments may persist for longer post-consumption and may continue to exert impairing effects in executive functioning even 3 weeks after abstinence. The occupational relevance of that is certainly unknown at this point. The conclusion is that either single or recurrent cannabis consumption is not recommended for persons who perform safety-sensitive tasks. Even though this is reliant on crash risk data, the recommendation is extended beyond operation of motor vehicles to include any task that may require a high level of cognitive functioning and judgment, and may furthermore not be restricted to so-called safety-sensitive workers. In decision-critical settings, also, cognitive and performance impairment resulting from cannabis use may pose a foreseeable threat to occupational safety as well as to the well-being and bottom line. We've included a list of resources which we hope will be helpful, and we look forward to your feedback and comments. Please help us identify future topics for further discussion. Thank you.